GLP-1s are definitely, for me, a mainstay now in people that are struggling with their metabolic health. And we could talk about weight loss separately and completely differently, but I think metabolic health, 90% of Americans right now have some degree of metabolic health issues, and it has to be addressed because it is the root cause of almost every other problem out there.
It upsets me enormously when we see people with very large platforms speaking up about GLP-1s as if we are offering people poison.
Right.
When I'm like, first of all, if 90% of us are not metabolically healthy, it is a public health crisis. We need public health crisis interventions.
When we start putting the pieces together, we realize that metabolic dysfunction is the root cause physiology driving most of the chronic disease and most of the chronic symptoms facing most Americans today. It is the issue that we need to be focusing on. It's broken in over 90% of American adults. It's caused by our, toxic, modern, rapidly changing industrial world and how that's hurting our cellular biology.
So let me move on to metabolic health. So, and this is a rhetorical question, of course. Do you think that we should start thinking about metabolic health once we get diagnosed with diabetes, or should we be looking at things earlier?
So I can assure you that I am so proactive about helping patients avoid ever developing prediabetes or diabetes, because I think that if you look at the research on what diabetes does to our risk factors for just about everything, atherosclerotic cardiovascular disease, stroke risk, cancer risk, et cetera, you should avoid diabetes like your life depends on it, because it does.
It's not like a switch is turned on all of a sudden when you get diagnosed with diabetes, now your risk factors start going up.
It's been that way.
The entire time you're developing diabetes, you're increasing your risk of everything else.
And here's the thing, like if you wait until your fasting glucose is 95, 98, 102 to intervene, you're already there.
Right.
Like I think it was Robert Lustig that said on my podcast, when your fasting glucose is between 90 to 99, you are at 30% greater likelihood of developing diabetes. So fasting insulin's important, uric acid's important. A1C, do I put a lot of like credence in that? I think it could be valuable, but that to me is certainly not as important as HDL to triglyceride ratio, super important. Your waist to hip ratio, super important. What a lot of people fail to recognize is there's many different things that start to happen as your fasting insulin is worsening. And, it could be something like your blood pressure starts to fluctuate a bit. It could be that you're getting more frequent urinary tract infections. I mean, there's so many things that we just don't think about as a like whole constellation. And then just forget about navigating perimenopause. I mean, that you're losing insulin sensitivity just like you're losing muscle mass. And all these things coming together are like the perfect toxic brew for developing diabetes if you don't work against it.
But GLP-1s are definitely, for me, a mainstay now in people that are struggling with their metabolic health. And we could talk about weight loss separately and completely differently, but I think metabolic health, 90% of Americans right now have some degree of metabolic health issues, and it has to be addressed because it is the root cause of almost every other problem out there.
It upsets me enormously when we see people with very large platforms speaking up about GLP-1s as if we are offering people poison.
Right.
When I'm like, first of all, if 90% of us are not metabolically healthy, it is a public health crisis. We need public health crisis interventions.
I give every patient on a GLP-1 a continuous glucose monitor and a nutritionist consult. I think those two go hand in hand. You can change your relationship with food, which will eventually lead to maybe you don't need the GLP-1 anymore. But let's at least get your metabolic health under control, right?
What's interesting about that $4.6 trillion we spend on healthcare, 1 out of every $4 is spent on diabetes, primarily type 2, which is a metabolic disease that is 100% preventable. I'm talking about type 2 diabetes.
Absolutely.
And 100% reversible.
I love it. Okay, so, one of the things I did not realize is the breakdown that 1 out of every $4 is spent on diabetes type 2.
Primarily, it's diabetes total, but like 95% is type 2.
Primarily, The prevalence of type 2 versus type 1 is massive.
There's a study that I put in the book. It's called the Whitehall 2 study, which shows you could have full-blown insulin resistance for 6 to 14 years without your blood sugar shifting a bit, because your body, and for those who don't know, when you eat food, especially carbohydrates, there's an increase in glucose, and then the pancreas produces insulin to clear that, And when that happens from time to time, you're good.
And your body's really good at doing that.
Yeah, acutely, but when it's chronically, that's the issue, right? So you could have insulin resistance for 6 to 14 years, and you're not checking your fasting insulin, so you have no idea. So a fasting insulin is the most important test, I believe, to get done for most people, especially if you're a beginner here.
We traditionally, in Western medicine, we check hemoglobin A1C, which is a 3-month average of your blood sugar level. This will be literally the last thing that changes in the spectrum of metabolic health, right? The first thing that's going to change is your fasting insulin, because your body is disposing of glucose using this hormone insulin, and it only usually should need a little bit of it, not a lot of it. Once you start secreting a lot of it, it means that your body's getting harder and harder for your body to handle the glucose levels.
Yes.
Right? So the first biomarker to change, you said 3 to 16 years, is that right? Before
6 to 14 years on average before you see the blood sugar shift. Yes.
Let's talk about some of these causes, because we've said carbohydrates a couple of times.
There's a time and a place for carbs, and I love keto, but I'm not a dogmatic do keto forever sort of guy. I think there's a role for it. However, 93% of Americans, according to a 2022 study I have in the book, are metabolically unhealthy. They are sugar burners. And there's nothing wrong with using sugar as a fuel source unless you're always using sugar as a fuel source for years and decades. So if you're in that category of 93% of people being unhealthy, I recommend lowering that total carbohydrate intake, increasing protein and fat. Protein has a very moderate insulin response, fat, very minimal. So if you just made that swap right there, you'll start to regulate blood sugar.
So all of these problems stem from, sounds like leaky gut, inflammation, etc. Sounds like they stem from having an unhealthy microbiome then.
Sometimes it's difficult to tease whether unhealthy microbiome is causing X or is X causing an unhealthy microbiome.
What I've seen so many times in my clinic is when we start treating the leaky gut and we eliminate it, the skin condition goes away without a drop of any skin ointment or anything to locally treat the skin problem. So this is a massively important topic. Is so many people out there are suffering from psoriasis, eczema, many skin rashes that come up out of nowhere and they don't know what's causing it. Look in the gut.
And what you just said as well about treating that gut, it correlates with data we have on rosacea, for example.
Yes,
in
true.
certain cases of rosacea, when they're given antibiotics to target specific pathogenic bacteria, not only does their skin condition clear up as well, but their gut also seems to settle.
It's interesting. What about acne?
There's an inflammatory component within that. And now we've come full circle to understanding that, yes, diet does have a huge role to play in acne, especially high glycemic load foods, which can worsen acne potentially or exacerbate it. I don't think we can say that diet causes acne or directly causes in any way, but certainly exacerbates and contributes to it. And the really interesting thing is, if we look at some of these non-industrialized populations, people in those places, like the Kitavan Islands, I think in Papua New Guinea, they have incredibly low rates of acne, almost 0% incidence of acne, because they live on a wholly, unprocessed diet. But when those people migrate to Western countries, they start to develop modern metabolic disorders, including high incidence of skin conditions. Now, that's not genetic, that's an environmental influence, and that's likely contributing to their acne, the change in their food.
Having an unhealthy microbiome leads to systemic inflammation. So an overactivity of your immune system systemically, meaning throughout your body, your skin being part of your body, but also inflammation can affect your brain and your heart and your immune system and your joints, all of it. And so how do you get from having an unhealthy microbiome to having systemic inflammation?
There's multiple routes by which this unhealthy microbiome leads to inflammation. One is, you're not feeding the bacteria well enough. And just simply not feeding them, as we suggested, it causes them to sort of just go rogue and start to switch on this pro-inflammatory cascade.
When your gut bacteria is unhealthy, it exposes your cells of your gut to all the toxins at a much higher level that come into our diet. And that can also be very inflammatory to our gut cells, cause them to separate, which is also known as leaky gut. And when leaky gut happens, toxins flow easily through the gut lining to our immune system, which then causes massive inflammatory reaction too. 90% of Americans on average have some level of poor metabolic health, right? And so I have a lot of patients coming to me and they're asking me like, do I have poor metabolic health? It's important to understand whether or not you're headed towards diabetes, but also headed or also like in a state right now of metabolic disease. And so I think for the listeners of this podcast, I would love for you to just kind of give a big picture explanation of what metabolic disease is.
But what I really believe is that we think about physical health and mental health. Both of these sit on a foundation, which is metabolic health. Basically, how your cells take in the environment, nutrients, et cetera, that we provide and turn it into energy. That's metabolism. And if your cells, so every cell in the body needs to have energy production available to it. And if the cells in certain compartments of the body, certain systems, are unable to produce energy in a clean and efficient way, it starts to produce byproducts that are damaging not just to that cell, not just to that system, but also cascade into the wider system and create inflammation, oxidative stress, and long-term breakdown. When that starts to deteriorate, neither mental health nor physical health can long-term be possible because metabolic health is not there.
And I think the more ways people think about their metabolic health in hearing it from different people, the more they understand the seriousness of it, because it is the foundation of health. Energy is life. And when you cannot make energy efficiently or the system is thrown off, which is basically saying that your metabolism is off, you cannot live life to the fullest. And it leads to every kind of chronic disease, whether it be cancer or heart disease or diabetes, Alzheimer's, or even thousands of other diseases out there, autoimmune diseases, all of them have a foundation in metabolic health. One data point, in my opinion, that makes the most difference, right? And so that's why the continuous glucose monitor is so important, because it is a direct way to influence that foundational level of your health, which then influences everything else after it, right? So if you want to avoid disease, just get your blood glucose levels right. I think that's super critical.
Yeah. Yeah, it's. I mean, it can't be overstated how important it is.
People should know their insulin level, and I can tell you, I would say 99.9% of doctors out there don't test this. If you're not managing your insulin from a young age, maybe even your 20s, I think,
100%.
Tracking where it's going directionally, you have no idea you're headed towards diabetes, metabolic
20s,
syndrome.
we have 2-year-olds with type 2 diabetes.
2-year-olds?
3-year-olds. Yeah,
No.
Native American kids drinking soda from the time they're born. Glucose elevation is a late stage phenomenon.
Right.
Your first thing that happens is your insulin goes up after you have a meal. Then fasting insulin goes up. Then your sugar goes up after a meal. Then your fasting sugar goes up.
Right.
So the time your fasting sugar's up, you're already 4 stages down the road.
Exactly.
I think that loss of muscle is the beginning of the end for people. And you get more inflammation, you get more insulin resistance, you get more just hormonal dysregulation, and all that is totally preventable. And when you, for example, you lose muscle, you get lower testosterone, you get higher cortisol, you get lower growth hormone, you get more inflammation, you get less ability to take up insulin.
We measure it when it's already a problem. And now it's all of a sudden like, oh, let's focus on your insulin and monitoring it so we can figure out how much insulin to give you versus way at the beginning. So,
Right.
It's like this medical education system is so still stuck in that, like from the same medical education system that we had. It's crazy that it's not advanced since then. And it's really just about diagnosing disease and what's the pill to treat the symptoms of that disease.
And you don't have to treat all the diseases individually.
Right.
Like when people have like this whole concept of comorbidities in medicine, which is like, you have 5 different diseases, they're all separate, they all need different drugs. I'm like, this is the most stupid idea I've ever heard. They're all connected.
Right.
It's not random that you have all these different conditions. They're all connected by common root causes.
What is the one kind of big overarching factoid that you want to give to the audience to say, this is, out of all the things out there, if you're going to look at the Pareto principle, the 20% of the information that's going to make 80% of the difference?
Yeah. I mean, we have to all be focusing on the mitochondria, this part of our body that makes the energy that is the foundation of all health. I think just reorienting this crazy health journey that so many of us are on, trying all the different things and orienting it around what is supporting the mitochondria. I think that's the key message that people, if they understood that and knew the basic ways to track the function of this beautiful little part of our bodies and also know how to support it, we would get so much farther. We would get so much farther in our efforts. You know, we're just throwing a lot of spaghetti at the wall, but if we threw it towards mitochondrial health, that would really help. The amazing thing is that, and this is sort of a key factoid that I think can really help people, is that there are some very simple tests that can give us sort of a gestalt of what's going on with this aspect of our health.